Hello, everyone, and a warm welcome to the virtual awards ceremony of the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health for the year 2023. Before I begin, I'd like to introduce Ms. Preeti Sapra and Ms. Sara Sharma, our sign language interpreters for today's event. To view our sign language interpreters through the event, I'd request you to please join the webinar from a laptop or a desktop. You may not be able to view them if you've tuned in from a phone or a mobile device. My name is Meera, and on behalf of the Center for Mental Health Law and Policy at the Indian Law Society, Pune, I would like to express our sincere gratitude to each and every one of you joining us from different parts of the world and taking the time to be present here today for this truly momentous occasion. The Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health was instituted by the Center for Mental Health Law and Policy in 2022 to honor the life and legacy of Mr. Keshav Desiraju, a former Union Secretary of the Ministry of Health and Family Welfare and an officer of the Indian Administrative Service who served in multiple positions in the Union government as well as the government of Uttarakhand over the course of his distinguished and extensive career. Today, the 11th of May, marks the birth anniversary of Mr. Desiraju, an exceptional individual who devoted his life to serving society, working tirelessly to bring about transformation in every role he took on. Mr. Desiraju was a person of unwavering honesty and integrity, striving for excellence in every sphere of his contributions. To quote him, he'd once said, "We must strive for excellence in what we do and establish a culture of devotion to duty," something you all would agree, a motto he firmly and fiercely lived by. Leading through example, Mr. Keshav Desiraju was instrumental in facilitating and drafting path-breaking legislations, establishing technical committees, and strengthening governance systems. As many of his colleagues describe him, he was a shining example of an exemplary civil servant who recognized the value of technical experts and those working on the ground, as well as supporters and critics alike. His inclusive leadership style made him an accessible and respectful leader who was always willing to listen and learn from others. His legacy is truly remarkable, spanning across public healthcare, human rights and social justice, education, environment, and the arts, deeply touching countless lives along the way. The Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health is an annual award that aims to recognize the contribution and efforts of individuals in government service who embody similar values as Mr. Desiraju, and through their work are regarded as allies in making advances in the field of mental health in India. Before I invite our first distinguished speaker for the day, we'd like to play out a short video clip that strings together some precious moments of Mr. Keshav Desiraju's life, shared with us by his elder sister, Ms. Srilata Iyer. A heartfelt thank you, Ms. Srilata Iyer, for sharing these precious memories of Mr. Desiraju with us. Thank you again. It is now with great pleasure and admiration that I introduce our first guest for this evening, Mr. Ramchandra Guha. Mr. Ramchandra Guha is a historian and biographer based in Bengaluru. He first met Mr. Keshav Desiraju in Almora in 1989. Thank you, Mr. Guha, for making the time to be present here with us today. I'd like to hand over the mic to you to share with us your memories of Mr. Desiraju, whom you have referred to as the most exemplary Indian of your acquaintance. Over to you, Mr. Guha.
Thank you. Thank you, Meera. Let me begin when I speak of the different ways in which Keshav was exemplary with his work as a public servant, which is how we are honoring him today. And it's truly wonderful that the Center for Mental Health Law and Policy has instituted this annual award. In his memory, has started an observatory to carry on his legacy in this particular field. Of course, his work in nurturing research and designing appropriate laws in mental health was pathbreaking. But there were other aspects of his work in health which were equally significant. For example, his work for especially handicapped people, and the fact that there is now affirmative action for them owes in part to what Keshav did as a public servant. There is his work in education and environment, Meera, which you referred to. There is extraordinary work in his adopted home state of Uttarakhand, in nurturing a cadre of civil servants who would build that state. Well, before that, there is his deeply impactful stint as the deputy director in Mussoorie Academy, and his mentees went to occupy many important positions and were continually inspired by his work, and we still hear from them what Keshav meant to them when they were in their early 20s in the Mussoorie Academy. So he was the most exemplary civil servant I have known, public servant I have known, not just civil servant. And I think that is a view widely shared by many of you who are come to honor him today. But think of him as a family person. He had 3 siblings, and he was a wonderful brother to each one of them. And I've seen this very closely at first hand in different and distinctive ways. He was exceptionally caring towards each one of his nephews and nieces. And the mails that I have got from several of them over this past 2 years, year and a half since he died, it tells you the kind of family man he was. In nurturing the legacy of his uncle and aunt, looking after his widowed aunt, nurturing the intellectual legacy of his uncle and his grandfather. So as a family man, I have not known someone like him. As a friend, how much he gave to how many people. And each one of us would have memories of that kind. And then finally, as a scholar, I have spent much of my working life in the Nehru Memorial Museum and Library. And usually at the microfilm desks, there are young historians, old historians, middle-aged historians. And the only non-historian I've known there who has spent a long period of time, my late friend Keshav Desiraju, who, when he was a joint secretary, he couldn't do this when he was secretary, would come at 5:30 and stay till 7 p.m. working on the microfilm. And his magnificent biography of M.S. Subbulakshmi is unequaled for its depth, its detail, its musical sophistication. And in all these ways, he was exemplary. And, I like to end with just an anecdote from last month. Last month, I was in Cambridge, Massachusetts, giving a talk on Indian democracy at the Massachusetts Institute of Technology. And though I did not mention Keshav, of course, you know that he embodied the pluralism and spirit of Indian democracy at its best, and the spirit of public service. But after my talk, someone came and introduced himself to me. He's a neuroscientist at the MIT called Pawan Sinha, who works on restoring sight to children with partial blindness. And he works with a charitable eye hospital in Delhi. And he was telling me about his work, and he just asked me off the cuff, "Did you know Mr. Keshav Desiraju?" I said, "Why?" He said, "I was a civil servant who most inspired me. I wish India had more like him." Now, it's a complete stranger to me. And each one of us would have this kind of experience. I knew Keshav well for 30 years, more than 30 years. His siblings and nephews and nieces are present here who knew him all their lives. Friends who were much closer to him than me. For example, Gopabandhu Patnaik and Gopal Gandhi are here. But after Keshav passed away, each one of us was brought, was struck, surprised, I would say surprised, struck, amazed, but not surprised by the range of people we had no clue about whose lives Keshav had transformed and who considered Keshav sometimes their closest friend, their mentor, their confidant, their beacon. So he was absolutely extraordinary. And I think what you are doing in this center, in carrying on his work, is the best kind of tribute to his memory. Since he's been gone, there have been several books already dedicated to him. One very fine book on the COVID pandemic, one on a Tamil social reformer, and I'm sure there'll be other books on very different topics written by people, or, which will show which will pay tribute to the person who inspired them in so many different walks of life. So I think celebrating his life, his work, and legacy, and taking it to people who never knew him in flesh and blood, I think is the best way of honoring Keshav. And I am deeply honored to be here at this second award ceremony of the Center for Mental Health, Law and Policy in honor of Keshav Desiraju.
Thank you so much, Mr. Guha. Thank you so much for sharing that with us. Indeed, Mr. Desiraju has had a profound impact on the lives of those around him. And I think more so on those who've been fortunate enough to call him a friend. Thank you so much, Mr. Guha, for joining us today. It fills me with immense joy and gratitude to now introduce and invite our next guest this evening, Ms. Shreya Iyer. Ms. Iyer is a professor of economics and social science at the University of Cambridge, a professorial fellow of St. Catherine's College, and deputy director of the Keynes Fund for Applied Economics. Her research encompasses development, economics of religion, demography, and health, with a focus on mental health. She read for economics degrees in Delhi and Cambridge and has been an academic at Cambridge for over 20 years. She is a research fellow of the Center for Economic Policy Research and serves on the Council of the Royal Economic Society UK and on the Pew Research Centre's India Advisory Board. Ms. Shreya Iyer is Mr. Keshav Desiraju's niece. Thank you, Ms. Iyer, for joining us this evening, and I would now like to hand over the mic to you.
Thank you so much, Meera, Saumitra, Amity, and colleagues. On behalf of Keshav's family and on his birthday today, thank you so much again for instituting the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health. Ram has just spoken about Keshav as a friend. I speak on behalf of his twin nieces, Soumya Rajan and myself. It has been so moving for Soumya and myself to hear over the last couple of years since his passing, the many wonderful memories and moving tributes paid to the uncle that we called Puchke Mama. Puchke Mama was a man of kindness, intelligence, wit, and compassion. His family members remember the twinkle in his eye and true passion for Carnatic music. His education, first in India and then here in Cambridge Economics, formed the basis of his understanding of inequality and health, subjects reflected in the work which he went on to conduct in the Indian Civil Service. Later in his career, Puchke Mama became interested in education, the environment, and mental health, pioneering the development of India's first Mental Health Care Act in 2017. Along the way, he made time for his many wonderful friends, and especially for his loving family, such as his sisters, Srilata and Sucharita, for whom his loss is still irreplaceable. Our memories of him was that he was avuncular, in that he always asked about our lives and what we were doing with them. He had time to prefer advice, but equally to listen. He was very loyal to his family, hugely affectionate, and thoroughly good fun to be around. He was with both of us at all the times in our lives when it really mattered. In our early years growing up in Mumbai, when we first went to school, when we needed advice to go to university, when our grandfather died in Almora on holiday, when I received my PhD in Cambridge, when we met and married our respective husbands, Chanda and Mukund, in Chennai. In fact, on Uncle Gopal Gandhi's tip-off, he met Chanda in Cambridge even before my parents did, just to make sure that he was a suitable boy. Mukund spent a summer in Delhi at the Environment Ministry before Soumya and he were married, and Puchke Mama would share his home-cooked food with the grateful Mukund. He embraced them all with his characteristic warmth and generosity. We remember the many thoughtful gifts from him. In the early years, it was books to open our minds, and in later years, gorgeous saris, always chosen with his impeccable taste. Saumya and I remember family occasions too, such as Varalakshmi Pujas, which were very dear to our grandmother Shakuntala. His last message to Saumya after she had done the puja at Kotagiri was to say, "That's nice. As I grow older, I think more often of my mother and her clarity of mind, a sense of purpose, a sense of duty, and all of that keeps me at peace." We remember happy times with Puchke Mama in the company of our parents, aunts and uncles, nephews and nieces, both Desiraju and Sarvepalli. We remember with hilarity baking cakes with him in his home in Almora on Grand Uncle Lakshman Rao's advice, trying to sieve atta through a Mysore cotton deshti to make cake flour. That cake was actually edible. We remember watching plays with him at London's West End, and Chandra and I remember taking numerous walks with him to his favorite Christ College whenever he visited us in Cambridge. But we also remember more serious discussion with him about the current state of India's politics, economics, and mental health. Puchke Mama's interest in mental health was deep, real, and profound. In his address on mental health in India at a conference in Somerville College in Oxford in 2019, which was subsequently published in the Journal of Public Health in October 2021, he argued persuasively, and I quote, "Public health is about social justice, and the task before India today is to demonstrate the political will, the administrative ability, and the democratic vision to achieve universal healthcare." He followed with great prescience in that address, "There can be no mental health without public health." And while that vision has certainly inspired others, it has perhaps equally influenced his family, with both Saumya's philanthropic involvement now with Vandana's Banyan, and my own research on religion, mental health, and economic well-being. Hence, we are convinced that Keshav, our beloved Puchke Mama, would have been pleased to know that this award in mental health has been set up in his memory, and that in so doing, we pay tribute not only to the man and his vision, but equally and especially to his legacy, those extraordinary individuals whose wonderful work in the area of mental health in India this award ceremony seeks to honor today. Thank you very much for listening, and namaskar.
Thank you so much, Ms. Iyer. Thank you for sharing such lovely memories with us. Mr. Desiraju's ability to uplift and connect with others at a soulful level has left a lasting impression and made him have a cherished presence in the lives of many. Thank you very much for joining us today, Ms. Iyer. We are delighted to be joined this evening by our next guest, Mr. Pravesh Chandra Gonial. Praveshji was a trusted companion of Mr. Desiraju for close to 25 years. Praveshji is attending the event at the moment, but he's also very graciously shared a short video clip with us that we would now like to present.
नमस्कार, मैं प्रवेश चंद गोनियाल उत्तराखंड पौड़ी गढ़वाल का हूँ और केंद्रीय समाज कल्याण बोर्ड में कार्य करता हूँ। आज 11 मई है और मेरे साहब जी का जन्मदिन है। आज मुझे बहुत खुशी हुई कि आपने मुझे इस समारोह में शामिल किया और साहब जी के बारे में 2 शब्द बोलने का मौका दिया। तो 1990 में मैं लखनऊ रहता था और साहब जी के एक दोस्त थे, उनके ज़रिए मैं साहब जी से मिला। साहब जी को एक कुक की आवश्यकता थी। साहब जी ने मेरा इंट्रोडक्शन लिया और पूछा, आपको क्या क्या आता है बनाना। मैंने कहा, मुझे तो सिर्फ आलू की सब्ज़ी आती है बनानी और रोटी, क्योंकि मैं पढ़ाई करता था तो उस वक्त इतना कुछ आता नहीं था। तो साहब जी ने कहा, चलो आलू टमाटर की सब्ज़ी बना के खिलाओ। तो मैंने बनाया। साहब जी को इतनी पसंद आई कि मैं पास हो गया। तो मुझे अच्छा लगा और साहब जी ने कहा, कल से सुबह मॉर्निंग में शुरू कर दो आना। उस दिन से मैं साहब जी के साथ जुड़ गया। अब साहब जी का 1991 में दिल्ली ट्रांसफ़र हो गया। साहब जी ने मुझे पूछा, आप मेरे साथ चलोगे दिल्ली? तो मैंने कहा भाई जी से बात करूँगा, अपने बड़े भाई से बात करूँगा। तब बड़े भाई साहब जी से मिले और साहब जी ने बड़े भाई को कहा, आज से मेरा छोटा भाई है, आज से इसकी पूरी जिम्मेवारी मैं लेता हूँ। और इस तरह से मैं साहब जी के साथ दिल्ली आ गया। 1992 में मेरी नौकरी लग गई। अब नौकरी लग गई तो साहब जी को पहले दिन में घर पे आते थे खाना खाने। अब एक समस्या और हो गई, कैसे क्या करेंगे। तो साहब जी ने मुझे कहा, परवेश सुबह हम नाश्ता करके ऑफिस जाएंगे और दिन का खाना तुम भी अपने साथ ले जाना और मेरे लिए भी टिफ़िन कर देना ऑफिस के लिए लंच, और उसके बाद शाम को हम मिलेंगे, शाम को फिर खाना खाएंगे। तो मेरे को बहुत अच्छा लगा जब साहब जी ने ऐसे बोला। ठीक फिर 1994 में मेरी शादी हो गई। शादी करके बच्चे मेरे गांव में ही थे, मैंने साहब जी को नहीं छोड़ा। मैंने कहा बच्चों को तभी लाऊंगा जब साहब जी यहाँ से ट्रांसफ़र हो जाएगा। साहब जी को कभी गुस्सा नहीं आया, कभी भी नहीं, और ना मैं गुस्सा हुआ। ऐसे ही हमने दोनों, साहब जी ने भी और मैंने, ऐसी ही ज़िंदगी काट दी। और 2015 में साहब जी का रिटायरमेंट आ गया। अब साहब जी ने चेन्नई शिफ्ट होने का प्लान बना दिया। ठीक 1 महीने बाद साहब जी ने एक सरप्राइज़ दे दिया। मेरे अकाउंट में कुछ पैसे आए थे। मैंने तुरंत साहब जी को बोला कि ये पैसे गलती से तो नहीं आए हैं। तो साहब जी ने मुझे कहा, नहीं परवेश, मैं सोच रहा था जिस तरह मेरी पेंशन लगी है तो तुम्हारी भी पेंशन लगा दूं। उस दिन मुझे इतनी खुशी हुई, मैं साहब जी को भी कुछ नहीं बोल पाया, मतलब बात ही नहीं कर पाया साहब जी से। और हर महीने पेंशन आती थी, उससे ऐसे लग रहा था कि साहब जी से अभी मैं जुड़ा रहूँगा। 5 सितंबर 2021 को सौमित्रा साहब जी का फ़ोन आता है और मृणालिनी मैडम जी का फ़ोन आता है कि साहब जी इस दुनिया में नहीं रहे। मेरे लिए शौक की बात थी। मेरे समझ में कुछ नहीं आ रहा था कि मैं क्या करूं। कम से कम आधा घंटा 1 घंटा तो ऐसे लगा कि ये हो क्या गया। हिम्मत नहीं हो रही थी साहब जी के पास जाने की, पर बड़ा हिम्मत करा मैंने, साहब जी के पास पहुंचा। उसके बाद रात हो गई, रात भर में साहब जी के बाद बैठा हुआ था, सोच रहा था कि ये क्या हो गया। नेक्स्ट दिन मैं दिल्ली वापस आ गया और रामानंद साहब जी का फ़ोन आया कि साहब जी की अस्थियाँ हरिद्वार में विसर्जित करनी है, आपको भी पहुंचना है। मैंने कहा ठीक है साहब जी। इस तरह जब से जुड़ा था और अंतिम दिनों तक साहब जी के साथ रहा। बड़ी दीदी और छोटी दीदी जी साहब जी की कमी पूरी करते हैं। उन्होंने कहा मुझे कि परवेश, साहब जी नहीं हैं पर हम लोग हैं, आपको कभी भी कोई परेशानी होगी तो हमें तुरंत फ़ोन करना। तो मुझे ऐसा लगता है कि साहब जी का आशीर्वाद मेरे साथ है अभी भी। और अंत में मैं आप सभी का हृदय से प्रणाम करता हूँ।
शुक्रिया प्रवेश जी, हमारे साथ आज यहाँ पे जुड़ने के लिए और अपनी निजी यादें और किस्सों को हमारे साथ बांटने के लिए तहे दिल से शुक्रिया। Thank you, Pravesh ji, for sharing your heartfelt and such personal and endearing memories with us today. Indeed, Mr. Desiraju's absence has left a deep void that we will continue to feel for many years ahead. We at the Center for Mental Health Law and Policy were privileged to have him as an integral part of many of our initiatives at the center. He shared a long-standing relationship with our director, Dr. Soumitra Pathare, spanning over a decade, during which they closely collaborated as part of the Mental Health Policy Group and spearheaded the redesigning of the District Mental Health Program and the drafting of India's Mental Health Care Act of 2017, a legislation that has been widely commended as forward-thinking and radical. Mr. Desiraju recognized that mental health and suicide prevention were intricate, multifaceted issues that intersected with social identity and discrimination. He worked to hold the state accountable and uphold principles of human rights and social justice. He lent his wholehearted support and played a crucial role in advancing our work at the center in multiple ways. In 2020, we launched an important project called the India Mental Health Observatory, now the Keshav Desiraju India Mental Health Observatory, that focuses on evidence-based policy making for advancing mental health in India. When we approached Mr. Desiraju, he very graciously accepted to be part of the steering committee and played an active role in shaping and advising the project. I would now like to invite Honorary Secretary of the Indian Law Society, Pune, Mrs. Vaijayanti Joshi, to share with us more about Mr. Desiraju's association with the Center for Mental Health Law and Policy and the Indian Law Society, Pune. Mrs. Vaijayanti Joshi is the Honorary Secretary of the Indian Law Society and Director of Academics and Administration at ILS Law College. She is a recipient of the prestigious state-level Asha Deep Award by Asha Deep Nyas Panvel for an invaluable contribution to the field of legal education for more than 2 decades. Her areas of interest are jurisprudence, family law, and administrative law. Thank you for your presence this evening, Mrs. Joshi. Over to you now. Ankita, would we be able to unmute from the back end?
Yes, I've sent a request to unmute.
Yes. We see you've unmuted, Mrs. Joshi. Yes, we can hear you. We can hear you, Mrs. Joshi.
Yeah, is this okay now?
Yes, perfectly fine.
Okay.
Thank you.
Okay, thank you. Mr. Guha, our chief guest today, all members of the jury, family members of Mr. Desiraju, awardees, Dr. Pathare, and dear friends. I'm indeed privileged and honored to address all of you on this occasion to remember a visionary leader, Mr. Keshav Desiraju. As I am the Honorary Secretary of the Indian Law Society, I would say a few words about the parent organization of the Center for Mental Health Law and Policy. The Indian Law Society was established in 1923 and has completed 100 years of its dedicated services to legal education. As a parent organization of the Center for Mental Health and Law and Policy, we always appreciate the tremendous work done by Dr. Pathare at the center, who has worked tirelessly for the last 15 years for research, action, and advocacy in the area of mental health law and policy. During this entire period of last 15 years, I had the occasion to meet Mr. Desiraju, who supported the Indian Law Society through the Center for Mental Health Law and Policy. His dedication and remarkable ability to drive the change have been a source of inspiration for many. He has had a significant impact on public policy in India and is widely recognized as the mastermind behind the Mental Health Care Act of 2017. As one of the oldest legal institutions in India, we recognize and truly appreciate the level of effort taken to orchestrate the enactment of the progressive legislation that is the Mental Health Care Act. The right-based approach put forth by the Act has made a significant impact in the advancement of mental health in India, and it will continue to do so as more and more states will fully implement the Act. In the last year, that is in 2022, I had the honor of announcing the renaming of the project at the center that focuses on evidence-based policy making for mental health, the India Mental Health Observatory, to the Keshav Desiraju India Mental Health Observatory in his memory. Desiraju's reputation as a bureaucrat, integrity goes far and wide. We at the Indian Law Society are really humbled to support this initiative by the Center for Mental Health, Law and Policy to offer our respect to him and reflect on his exemplary life and work. We are certain his legacy will continue to inspire many for years to come. Thank you very much.
Thank you so much, Mrs. Joshi, for your presence this evening. We're grateful for your support. Thank you again. While Mr. Desiraju is no longer with us, his vision for an improved mental health system remains. We at the Center hold great pride in our pioneering initiative, the Keshav Desiraju India Mental Health Observatory. To give you a brief overview of the work and the impact of this project, I'm delighted to introduce my colleague, Ms. Tanya Nicole Fernandez, who co-leads the project at the Center.
Thank you, Meera. Good evening, everyone. I am Tanya, a research associate at the Keshav Desiraju India Mental Health Observatory. It is my great privilege to speak to you today about the Keshav Desiraju IMHO. The project was established in 2020 and is supported by the Thakur Family Foundation. As mentioned earlier, Mr. Desiraju was instrumental in conceptualizing the project and was a key advisor and member of our steering committee until his passing. The Keshav Desiraju IMHO is a repository of data and information on the mental health system to promote evidence-based policy making and bridge systemic gaps for advancing mental health in India. Our mission is to improve mental health outcomes by facilitating equitable, accessible, affordable, quality, and rights-based mental health care. Our overall objective is to create a collaborative mechanism by engaging with a range of stakeholders, from policymakers and mental health professionals to researchers, people with lived experience, and civil society organizations to collect, collate, and disseminate data and research on mental health law, policies, and services at all levels of the governance structure. Our work is broadly classified across 7 thematic areas, ranging from the implementation of laws, policies, and programs on mental health and suicide prevention to budgets and structural determinants of mental health. Over the past 3 years, the Keshav Desiraju IMHO has produced over 43 publications and outputs, including but not limited to 3 consecutive years of the budget brief on the Union Budget for Mental Health, issue briefs that deep dive into diverse topics within our thematic areas, practical manuals in multiple language on supported decision-making or provision under the Mental Health Care Act 2017, comments on bills, policies, and guidelines to provide rights-based mental health care, articles to promote public awareness on intersectoral targeted action for suicide prevention and improving mental health, and continued efforts to assess the quality of media reporting on suicide by way of an initiative called Project Siren, which is an acronym for Suicide Reporting India Watch. To highlight some of our notable initiatives in the last year, the Public Archive is a crowdsourced digital open access initiative to make data and information on mental health laws, policies, and programs accessible. Public Archive currently houses over 130 documents, including RTIs, court judgments, circulars and notifications, and law policy documents sourced from different collaborators. The Public Archive will in the future expand to other data sets, including government reports and parliamentary questions on mental health. We have also entered into a partnership with the state government of Chhattisgarh to conduct an audit of the district mental health program. We conducted a pilot study in the state to understand the functioning of the DMHP and patient satisfaction in terms of access and quality of services. In the next few months, we will scale up the DMHP audit across the state and conduct yearly reviews. Lastly, in the spirit of the Mental Health Care Act 2017, we have been advocating for health insurance coverage of mental illness on par with physical illness. Over the past 2 years, the team has assessed over 300 health insurance policies to determine the extent of mental illness coverage which is available as an open access dashboard for individuals to choose an appropriate policy. More recently, along with a close partner, we have directly been engaging with private health insurers and a regulator to create awareness with the dual aim that people with mental health conditions get their due claims and are no longer denied insurance coverage. Considering the breadth of the project, we have a dynamic and interdisciplinary team of researchers, interns, and consultants from varying fields of mental health, health systems, finance, policy, communication, and technology. In the next few years, the Keshav Desiraju IMHO has plans to expand to innovative and impactful areas of work across new geographies, honoring Mr. Desiraju's vision to advance mental health care in India. We are constantly looking for partners and funders to support our work. If you are interested, please contact us at imho@cmhlp.org. You can also visit our website to subscribe to our newsletter and learn more about our work. Thank you. Back to you, Meera.
Thank you so much, Tanya. We at the Center are honored to carry forward Mr. Desiraju's commitment to strengthening the mental health system of India. Now, before I introduce you to our eminent jury for this year's award, I'd like to briefly take you through the selection process and methodology followed by the organizing committee and the jury for the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health. As part of the selection process, we invited individuals across the country to nominate themselves or others who met the eligibility criteria. The announcements were made across social media platforms, our website, as well as through emailers to various individuals and networks. The application form consisted of 4 rigorous sections, each with a set of questions to learn more about the individual, their work, and their future plans to advance the field of mental health in India. We received a total of 17 nominations. These included self-nominations and nominations by others. The jury then individually reviewed and thoroughly discussed and deliberated over every nomination to arrive at a joint decision on the most deserving recipient of the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health for the year 2023. The award recipient will receive a memento and plaque specially designed in honor of Mr. Keshav Desiraju by artist and sculptor Abir Patwardhan. The memento is an effort to encapsulate Mr. Desiraju's multifaceted and passionate personality. It takes the shape of a flowing, organic form, serving as a visual representation of his immense generosity and spirited demeanor. The award recipient will also receive a certificate and citation by the jury, a cash prize of 50,000 rupees, and Mr. Desiraju's last completed work, published in 2021, the critically acclaimed book titled Of Gifted Voice, The Life and Art of M.S. Subbulakshmi. It is with great anticipation that we now turn to the announcement of the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health for the year 2023. And for this, I am honored to introduce you to each of our esteemed jury members. I will start with Mr. Amitabha Bhattacharya. Mr. Bhattacharya, a mechanical engineer by education, joined the Indian Administrative Service in 1975 and was allotted the Andhra Pradesh cadre. He spent over 30 years of his career in various leadership positions at the center and state level. He retired in 2009 as Principal Advisor, Education and Culture from the Planning Commission in New Delhi. He also served the United Nations Development Programme as the Chief of Programs in the fields of energy and environment for 5 years. Post his retirement, he served as a Director of Development Consultants Private Limited, where he started his career and has held positions as a Fellow of the Institution of Engineers in India and the Vice President of the Consulting Engineers Association of India. He's been awarded with the Distinguished Alumnus Award by his alma mater, the Bengal Engineering and Science University of Shibpur, now known as the Indian Institute of Engineering, Science and Technology, Shibpur. He now writes on issues of public interest for various newspapers and journals. In 1987, Mr. Bhattacharya joined the Lal Bahadur Shastri National Academy of Administration in Missouri as a faculty member, where he first met Mr. Keshav Desiraju, and their friendship continued over the years. Thank you, Mr. Bhattacharya, for being a part of the jury and joining us this evening. Our next jury member is Dr. Soumya Swaminathan. Dr. Swaminathan was most recently WHO's chief scientist and previously Deputy Director General for Programs. During the pandemic, she played a key role coordinating scientific efforts at WHO. A pediatrician from India and globally recognized researcher on tuberculosis and HIV, she has 30 years of experience in clinical care and research, working throughout her career to translate research into impactful programs. Dr. Swaminathan was Secretary to Government of India for Health Research and Director General of Indian Council of Medical Research from 2015 to 2017, and focused on bringing science and evidence into health policy making, building research capacity in Indian medical schools, also forging South-South partnerships in health sciences. From 2009 to 2011, she served as coordinator of the UNICEF, UNDP, World Bank, WHO Special Program for Research and Training in Tropical Diseases, Geneva. Dr. Swaminathan first met Mr. Keshav Desiraju when he was the Union Health Secretary, and thereafter stayed in touch. After his retirement, she worked closely with him on a number of initiatives on mental health, where he served in an advisory role. As you may see that Dr. Swaminathan has joined us right now, but she's also very graciously recorded a video with us. Depending on your availability, ma'am, we will either play the video or we would ask you to go live from wherever you are. Our third jury member is Dr. Anand Bhan. Dr. Bhan is trained as a medical doctor with a master's degree in bioethics from the University of Toronto. He's an adjunct visiting professor at Yenapoya, deemed to be university, and is immediate past president of the International Association of Bioethics. His work is focused on ethics and equity in health, mental health, digital health, public health ethics, research ethics, community engagement, ethics of innovative technologies, and ethics training for professionals. Dr. Bhan has been a resource person for trainings and serves as a guest faculty in various educational institutes in India and abroad. He serves as a mentor for the Sangat's Bhopal Hub and is the principal investigator of various projects at the Hub, funded by both international and national funders. Dr. Bhan worked with Mr. Desiraju as a member of the Public Health Advisory Board for the Thakur Family Foundation, and through that experience and related interactions, got to know him and his commitment to public health, mental health, and social justice in India. Thank you, Dr. Bhan, for being part of the jury and joining us this evening. I would now like to pass on the mic to the jury members to share a few words reflecting on their association with Mr. Desiraju, the significance of this Memorial Award, and of course, also announce the recipient of the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health for the year 2023. I'll hand over the mic to Mr. Amitabh Bhattacharya first. Over to you, sir. Sir, you're on mute. If you could unmute yourself, please. No, we can't hear you. There would be on the left bottom, there'd be a mic, something saying unmute. If you could just tap on that.
Okay.
Yes, thank you.
It's difficult for me to be objective about Keshav Desiraju. I met him in August 1987 in Lal Bahadur Shastri National Academy of Administration in Missouri. He was 5.5 years my junior in age and about 3 years in service. Our friendship matured with time and continued till death took him away rather early, when there was a lot left in him to do. He was happy with the response to his book on MS Subbulakshmi and was planning to write one on Tyagaraja. Earlier, he had also co-authored a book on healthcare corruption in India. Writing such books upon retirement came naturally to him and was not outside his sphere of commitment to the cause he held dear to his heart. He remained the same person before and after retirement, which is very unusual for civil servants. He didn't suddenly turn a retired radical, nor was he planning to write his memoir. As a civil servant, what made him unique? The quality of his mind has been much talked about. Ramchandra Guha has mentioned, Mr. Gopal Gandhi wrote, "What a fine mind, with words to match." Keshav, the shy person that he was, would have been embarrassed by the torrent of tributes paid to him after his demise. I also joined them, penning one article with Sujata Rao for The Wire and another consisting mostly my memoirs about Keshav, my association with Keshav for The Statesman, titled "The Memories Will Not Fade." What made Keshav special, however, is neither his scholarship, nor his civility, nor his acute mind, all of which he had possessed in ample measure. He stood out for his commitment to causes he held dear while discharging his official responsibilities. His heart was at the right place. In the Mussoorie Academy, he developed an interest to include and work with groups and individuals, mostly from the voluntary and non-governmental sectors, as we generally term them as civil society. This stood him in good stead. And he had worked in areas mostly in the social sector, both in the state government of Uttar Pradesh, Uttarakhand, and later in union government, in areas related to environment, public health, and education. About what he did in public health is known, but he also, as a middle-level officer in the Ministry of Environment, did a lot in the around 92, 93, 91, 92, early 90s, when India's response, government of India's response to the United Nations UNCED, what is known as Conference on Environment Development Review, was being chalked out. He and his superior, Mr. Rajamani, another very outstanding officer of Andhra cadre, worked together as a team and did substantial work, which I came to know because I was coordinating those activities from the UNDP side in Delhi office. Later, Keshav succeeded me insofar as the environment part of the work is concerned. There he did substantial work. And of course, his work in the field of mental health is well known, as also in the field of education. These are areas where he excelled and where his best used to come out. As a civil servant, he was posted in different places under different kinds of assignment. But these are the areas, the social sectors, where the best of Keshav used to come out. He was able to see the enormous role of civil society organizations in strengthening or reinforcing governmental initiatives for public good. I think as a civil servant, Keshav's unique contribution was in this particular area. This passion he pursued all his life and was largely successful at. He is known as the main force behind the mental health care bill, but although he died rather young, he saw to it being enacted and getting implemented. Hope Keshav's deep commitment to public service will be continued and sustained in the years to come. Thank you.
Thank you so much, Mr. Bhattacharya, for sharing that with us and also being a part of the jury of this award. Thank you again. Like I'd mentioned earlier, while Dr. Soumya Swaminathan is attending this event, she will not be able to speak live due to unexpected travel, but she's very graciously shared a short video with us that we would now like to present.
I'm so glad that we're having this function to give awards to people who've been champions for mental health, that we are recognizing the memory of Keshav Desiraju. And I really want to thank the Center for Mental Health Law and Policy for having instituted this award, and we know that we're in the second year of this award. I also want to thank and recognize all the people who have been nominated for this award, and it was very heartwarming to see the kind of work, the breadth and scope of work that's been undertaken in India. It's increasing for sure in quantity and quality, and the jury had very in-depth discussions in order to select the winner. My association with Keshav goes back many years. My only regret is that we didn't get to work together more directly in the health ministry, because by the time I made it to Delhi as health secretary for health research, Keshav had already moved out of the health portfolio. But what he achieved gave me so much of hope, and also was sort of a beacon, because you can often get lost in the maze of bureaucracy and wonder how can anyone get anything done, particularly when you have to move files. And looking back to see how Keshav had made sweeping changes actually in the way, not only in bringing in the national mental health policy, but also in things like the National Technical Advisory Group on immunization, which completely transformed the way in which immunization policy was done in India in a very ad hoc manner prior to actually setting up this committee and making the whole process much more transparent and fair and inclusive and science-based. Keshav was somebody who listened quietly, but he was listening intently. He took new ideas, and he didn't just want a problem to be stated or investigated, but actually wanted to find a solution, however difficult or challenging that may have appeared. And he did. We also shared an interest in Carnatic music, though of course he was much more of a connoisseur than I will ever be, and a lot of common friends in Chennai and in Delhi. So in many ways we had personal friendship and bonds beyond our interactions in government and working in health. And I really miss him and his wise counsel today. So it's again very nice to be able to be on a jury and look at all the fantastic work that's being done by the nominees. And I want to applaud and congratulate each one of you who were nominated for this award. And all best wishes to you for your future work.
Thank you so much, Dr. Soumya Swaminathan, for being a part of the jury. I would now like to hand over the mic to our next jury member, Dr. Anant Bhan. Dr. Bhan, over to you.
Thank you so much, Meera. So I want to take this opportunity to say that, it's certainly a proud privilege for me to be a jury member for an award which celebrates an exemplary person like Keshav. Thank you also to the center team for organizing today's event with such touching remembrances being shared. I got to know Keshav perhaps more recently than most others on the panel today, primarily through my engagement in public health. But having had the pleasure to be in person meetings with him on calls and extended discussions, I was really amazed to see a dignified individual who, despite having been a secretary to the government of India, was very well known also as an individual, was still so humble. He was always very curious in these discussions. He was open to understanding new perspectives and opinions, but he was certainly very opinionated as well. And he would bring in a lot of insight and past experience to bear when he would express his opinion. Keshav had a deep understanding of Indian society, including civil society, which is usually, a gap area, I guess, for many bureaucrats. Civil society is seen as this sort of range of people who are doing something, but some, a range of people who are not very well understood often. He was involved in supporting and promoting several civil society initiatives once he was convinced that they had their heart in the right place. As a person, he was also very deeply committed to addressing gaps in policy for those who are among the most marginalized in society. And this is where I think his critical leadership in mental health, including the enactment of one of our most progressive acts, the Mental Health Care Act, was especially significant. Keshav was a man of many talents and very good at all of these talents. These included, of course, developing and cultivating a vast legion of admirers, followers, and friends. And this is a testament to the amazing personality that he was. When we actually met as a small group in Chennai as part of a committee we were both members of, he would ensure that there were personal recommendations and sometimes even make reservations at restaurants for us to make sure that we got an authentic Chennai food experience. The award instituted in his memory is a celebration of two areas Keshav was very passionate about: mental health and public service. It is great that through this award, we can recognize leadership in this domain and at the same time also continue to bring attention to mental health and the important role of public service in today's times in this country. As jury members, we were, we saw a range of applications this year. It was a higher number than last year. Excellent applications, which were a mix of nominations and self-nominations, range from both early career to mid-career to senior professionals from the fields of academia, research, health provision, bureaucracy, as well as civil society. For the jury, it was certainly challenging, given the range of important and impactful work that we saw reflected in the applications. But as jury members, after a detailed discussion, we could come to a consensus on the awardees for this year for the Keshav Desiraju Memorial Award 2023. I would certainly like to congratulate all the nominees and also the awardees for this year. And for announcing the award for 2023, I would like to pass on the microphone to Amitabh-ji to do the honors. Thank you so much.
Thank you very much. You have explained very clearly, and other speakers had also made it very clear how competitive this year's process was and why, under what circumstances it was decided that 2 persons should be awarded this distinguished award. Now, I have great pleasure in congratulating first and naming the 2 individuals who have been selected through a rigorous process by the jury members. One is Mr. R. Prasanna, Secretary Health, Chhattisgarh, and the other, Dr. P. Rajani. I congratulate both of them, and I wish they would continue to spread the good work, to continue to do the good work that they have been doing in their respective fields. Thank you very much.
Thank you, Mr. Bhattacharya, Dr. Swaminathan, and Dr. Bhan. Many congratulations, Dr. Parthasarathy and Mr. Prasanna, on behalf of the organizing team on this well-deserved recognition. Before I hand over the mic to you, I'd like to read out the jury citation. I quote, Rajani Parthasarathy is awarded the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health 2023 for her remarkable contributions to advancing mental health in Karnataka. Through her training as a psychiatrist and work in multiple assignments with the Department of Health and Family Welfare, Karnataka, since 2004, Dr. Parthasarathy has demonstrated an unwavering commitment to public service in the field of mental health. As Deputy Director of Mental Health, Department of Health and Family Welfare, Karnataka, she's played a significant role in the expansion of the district mental health program there and implementation of the Mental Health Care Act of 2017. Through her career, she's also initiated several programs aimed at improving mental health among vulnerable populations, notably among inmates at the Central Prison Hospital, Bangalore, and at protecting women and girls against violence. Dr. Parthasarathy's long-standing dedication to mental health and demonstrable record of initiating and supporting collaborations across government ministries, as well as with civil society organizations, make her a meritorious recipient of this award. The jury citation for Mr. Prasanna, I quote, R. Prasanna is awarded the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health 2023 in recognition of his efforts in advancing mental health in Chhattisgarh. Through a notable career spanning 18 years in the Indian Administrative Services, Mr. Prasanna has held roles in multiple departments before being appointed as the Secretary, Department of Health and Family Welfare, Chhattisgarh. He has successfully overseen the implementation of technology-driven programs for improving access to mental health care, such as telementoring and training programs for health professionals in Chhattisgarh by working with partners such as NIMHANS. Through his leadership, the state has made significant progress in mental health care by way of increased budgetary allocation, upgradation of existing services, capacity building, and introduction of suicide prevention initiatives. In addition to his contributions to mental health, Mr. Prasanna was awarded the Prime Minister's Award for Excellence in Public Administration for the year 2013 to 14 for his work on addressing malnutrition. His record demonstrates an understanding of complex and systemic challenges within governance and his ability to effectively implement solutions for improved health and mental health. Mr. Prasanna's personal commitment, vision, and leadership in the sphere of mental health and perseverance through the years make him a worthy recipient of this award. I will now hand over the mic to both of you, beginning with Dr. Rajani first. Over to you.
Thank you very much. I'm truly delighted and blessed to get this prestigious Keshav Desiraju Memorial Award, Service in Mental Health 2023. Am I audible?
Yes, Dr. Rajni, we can hear you, though we seem to be losing the link because we can't see you very clearly. But we can hear you. I think we've lost that link with her. If I can hand over the mic to you, Mr. Prasanna.
Yeah, thank you. It's an honor to receive an award instituted in the name of a great person who has selflessly devoted for the service of this nation, and especially among different sectors in the health sector also. He is a role model for many of the bureaucrats like me, and we look upon him during our tougher days in our career. And I also like to thank the Center for Mental Health Law and Policy for initiating award and recognizing people working in the mental health sector, and especially the public servants, because even today the mental health sector is not on the main agenda, and such recognitions to a public servant like us will help us to bring it into the main agenda, especially at the policy level, and also help in implementation in states like Chhattisgarh. I would like to thank my entire team at Chhattisgarh, especially the mental health team, and especially our consultant, Ms. Sumi Jain, who have been instrumental in all the tie-ups and also preparing the policies and implementation in the state of Chhattisgarh. And we are happy to say that Chhattisgarh has already taken big steps in improving the health sector, and especially the mental health programs across the state. And this recognition in the name of one of the best civil servants will help us to motivate further in working in the mental health sector. Thank you for the jury members, and also thank you for the Center for Mental Health Law and Policy. And thank you, everyone. Good day.
Yeah.
Thank you so much. Yes, I was going to hand over the mic to you, Dr. Rajni. Yes, we can hear you.
Yeah, thank you very much. I'm truly delighted and blessed to get this prestigious Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health 2023. I thank God, parents, my family, entire mental health team of Karnataka, my higher officers and friends and colleagues from NIMHANS for their contribution in supporting me in my endeavors. I thank jury members and the Center for Mental Health Law and Policy for choosing me for this award. So this will definitely motivate me to work much more harder in the field of mental health and reach the unreached. Yes, of course, miles to go before I sleep.
Thank you so much. Thank you so much, Dr. Rajni and Mr. Prasanna. And thank you for your deep pursuit and commitment to advance mental health in India. We wish you the very best for your future work, and congratulations once again. And thus we arrive at the end of this very special and significant evening for all of us. I'd like to invite Dr. Soumitra Pathare, the Director of the Center for Mental Health Law and Policy at the Indian Law Society, Pune, to deliver a vote of thanks. The stage is yours, Soumitra.
Thank you, Meera. Thank you. On behalf of the Center for Mental Health Law and Policy, as well as Indian Law Society, I would like to once again congratulate both the recipients, Dr. Rajni Parthasarathy and Mr. Prasanna. Your dedication and achievements in this crucial area are truly commendable and instrumental in making a significant impact on the ground in both Karnataka and Chhattisgarh. At least we think that this is a very serious event. It is a solemn event, but it is not a serious event in that sense. And Keshav would have never wanted it to be a very serious event. One of the things that I miss about Keshav is our Sunday morning gossip sessions. And anyone who knows Keshav very well will know that he was a real gossip. And I really, really miss that every Sunday. I would like to thank all of the jury members, Mr. Bhattacharya, Dr. Swaminathan, and Dr. Ban, for their time, effort, and guidance in this entire process. Our distinguished guests for the evening, Mr. Ramchandra Guha, Shri Iyer, and Pravesh Chandra, for graciously accepting our invite to be part of this special occasion. I would also like to thank our Honorary Secretary of the Indian Law Society, Mrs. Vaijayanti Joshi, as well as the Governing Council of the Indian Law Society for all their support. I am very thankful for all the nominators as well as nominees for taking the time to engage with this award and the application process. And I'm also grateful to Mr. Desiraju's family and friends for their continued support. Turning to the people who actually make these programs happen very well. Thanks to our excellent sign language interpreters for the day, Ms. Preeti Saini and Ms. Sarah Sharma, to all the attendees for taking the time to be present here today in memory of Keshav, and the entire CMHLP team, as well as the award secretariat, which has been responsible for organizing and coordinating the award every last detail. Thank you, Amity, Ankita, Sufwan, and Tanya. It has indeed been a pleasure to organize with the team and host today's event. Thank you to everyone for making the time to be here. We look forward to seeing you once again in 2024 to honor the life and legacy of Keshav, an extraordinary human being. Thank you.
Thank you so much, Soumitra. Like Soumitra said, we look forward to seeing everyone in 2024. But thank you for your presence today. Have a good evening.